Welcome everyone to our Legislative Basics 101. This is in anticipation of our Pharmacy Legislative Day, which is next week on Wednesday. So hopefully you've all signed up for that. And if you haven't, I can post a link to do so in the chat as we go forward. But tonight's webinar, we're going to have three parts to it. First part is going to be kind of just a legislative basics overview. And then we're going to have a focus on our talking points for our key legislation that we are working on right now. And then at the end, we're going to be having a video that we put together, kind of a do's and don'ts of how to talk to your legislators. Because some people, you may send emails, but you've never actually gone in and talk to your legislator in person about key bills that we're supporting. So this is going to give you a little overview of everything. So we hope you enjoy everything tonight. And Sarah, I will let you take it away.
Thank you very much. I will share. Okay. So we're going to go over some legislative basics. And our objectives or goals for tonight are pretty simple. We're just going to discuss how the legislative process works and how a bill becomes law. So political advocacy, both IPHA and ICHP actively monitor state and federal legislation and regulations that may have an impact on the pharmacy profession. And both groups represent our memberships and the profession by educating and discussing our positions with key legislators and regulators. And there is a legislative tracking report that is real time on both the IPHA Advocacy Center or the ICHP Advocacy Resources. We are currently in the 102nd General Assembly, which is comprised of the legislative branch of government in Illinois, just like at the federal level, is made up of two different groups or chambers, which are known as the House of Representatives and the Senate. Collectively, these two groups are known as the General Assembly. So the Senate has 59 members, 41 Democrats and 18 Republicans, while the House of Representatives has 118 members, comprised of 73 Democrats and 45 Republicans. Each of these members represents a specific geographic region within Illinois. So the Democrats have a supermajority in both chambers. And so far this year, the Senate has heard almost 3,000 bills and the House has heard just over 4,000. So for pharmacy, we're usually monitoring about 300 bills and resolutions at any one time. Generally speaking, the sessions begin in January and end at the end of May, and then veto session is held towards the end of the calendar year, usually in late October, November, or December. So for how a bill becomes law, in Illinois, any member of the General Assembly, either from the Senate or the House of Representatives, who has an idea for a law can draft a bill. These ideas come from the General Assembly members themselves or from everyday citizens and advocacy groups. The vast majority of all legislation considered by the General Assembly is actually drafted by a group known as the Legislative Reference Bureau. The Bureau carries out a wide range of functions relating to the legal and technical operation of the General Assembly. The primary task of the Bureau is the drafting and preparation of legislation, including bills, amendments, resolutions, and conference committee reports. In a typical biennium, this group produces more than 27,000 documents. Attorneys employed by the Bureau provide legal advice and drafting services to legislators of both parties and both houses, working on a nonpartisan basis in a confidential lawyer-client relationship. Once the bill has been drafted by the Legislative Reference Bureau, the sponsor introduces it in chamber. The sponsor is the primary General Assembly member who's supporting the bill. The other members who support the bill are called co-sponsors. Representatives introduce bills in the House, and senators introduce bills in the Senate. Bills are designated either House bills or Senate bills, depending on where they originate. Even when the bill moves to the other chamber, the original designation based on the bill's House of origin remains. For instance, one of the bills we are currently watching is Senate Bill 2008. It's still in the Senate where it originated, but later when it moves to the House, it will still be called Senate Bill 2008. Bills are numbered in order from the time of introduction, and then that continues throughout the entire General Assembly session, which is 2 years long. Once the General Assembly session ends, all pending bills die and the numbering starts over for the new General Assembly session. Legislation that dies in a session can be reintroduced in the new session, and it will be given a new number. After the bill is introduced, it is on the first reading. All bills must be read to the chamber 3 times. This does not mean that the entire text is read, just the bill number and title are read aloud by the clerk of the House or the secretary of the Senate. Once the bill is read aloud the first time, it then moves to the Rules Committee for House bills or the Assignments Committee for Senate bills. The committee members review the bills and decide if a bill will be assigned to a committee, and if yes, which one. Standing committees are permanent and they last between the General Assemblies. There are also special committees that deal with specific pressing concerns. Each committee is composed of groups of General Assembly members who are particularly interested in different topics, such as health or international affairs. When a bill is in the hands of the committee, it is carefully examined and its chances of passage by the entire General Assembly are determined. The committee may even choose to hold hearings to better understand the implications of the bill. Hearings allow the views of the executive branch, experts, other public officials and supporters, and opponents of the legislation to be put on record. During a committee hearing, during a committee hearing, the bill sponsor explains the bill to the committee members, who can then ask questions of the bill sponsor. The bill's proponent, generally an individual representing the interest group who asked that the bill be introduced, will often be present to explain in more detail why the bill is proposed, and they may answer questions about the bill. Lobbyists, interest group representatives, and private citizens may also testify their opposition or support of a bill. And often, subcommittees are organized underneath the committees and have further specialization on a certain topic. Committees refer bills to a subcommittee for study and their own hearings. The subcommittee may make changes to the bill and then must vote to refer the bill back to the full committee. And after the testimony is complete, the committee votes on the bill. A simple majority is needed to pass a bill out of committee. If a bill receives the required number of votes, it passes out of committee and goes to the full chamber. If it does not receive the required number of votes, the bill remains in committee where it can be voted on again, or if the committee does not act on a bill, the bill is considered to be dead. Bills can also be deferred until the time that a bill sponsor wants the bill in committee. This happens when opposing parties are working to make changes that they can agree on. Changes to a bill are called amendments, and they are heard in committee in the same manner as the original bill. After a bill passes out of committee, it is on the second reading. The title and bill number are again read to the full chamber, and the clerk or secretary also informs the membership if any amendments have been filed. A bill on second reading can still be amended. Regardless whether there is an amendment, the full chamber must vote to pass the bill to third reading. Bills on third reading are read for a third time, and discussion and a vote on the bill, including all amendments, take place in the full chamber. A simple majority is required to pass the bill out of chamber. In the second chamber, the engrossed bill, which is all amendments incorporated into the bill, goes through the same process again, including finding a sponsor in that chamber. The second chamber may approve the bill as received, reject it, ignore it, or change it. General Assembly may form a conference committee to resolve or reconcile the differences between the House and Senate versions of the bill. If the conference committee is unable to reach an agreement, the bill dies. So if we look at this in the context of an example, say we have House Bill 1 and it's introduced in the House and it goes through committee, subcommittee, back to the full House, and they decide that they want all community pharmacies to close on Sunday. So that's the House bill version. Then that goes over to the Senate and it goes through committee. And on the Senate side, they decide, well, that just doesn't sound realistic. We think they should close at 7 on Sundays. So then that will go through, since the two houses didn't agree, then that would go to a conference committee. And so that's where they would involve some from both sides to work together to find a version that both sides could agree with. So if the second chamber passes the same version of the bill as the first chamber, then the bill has passed the General Assembly and it is sent to the governor for his signature to sign the bill into law. If the second chamber adds any amendments to the bill must return to the chamber of origin for a concurrence vote. So in our example, then that would go back over to the House side for them to vote. And then once the bill has passed the General Assembly as a whole, the legislature must send the bill to the governor within 30 days. Once the bill reaches the governor's desk, 3 things can happen. First, the governor can choose to do nothing. If no action is taken within 60 days after the bill reaches the governor, it automatically becomes law. The second option is the governor can sign the bill into law exactly as it is. When a bill becomes law, by whatever means, it is called a public act and it is assigned a public act number. The governor can veto the bill one of 2 ways. A total veto means the governor vetoes the whole entire bill. An amendatory veto is when the governor makes specific recommendations for changes to the bill that, if made, he or she will sign the bill into law. This is also called a veto message. In the case of a veto, either type, the General Assembly can, 1, do nothing and the bill is dead, or they can override the veto by a 3/5 vote in both chambers. In the case of an amendatory veto, the legislature may agree with recommendations made by governor with a simple majority vote and the bill becomes law. So in our example, if the Senate and the House agreed that the pharmacies should close at 7 and then that goes to the governor could say, well, I don't agree. I think it should close at 6. And then that would go back to the General Assembly for another vote where they could either override it by a 3/5 vote or they could accept the changes by a simple majority vote. And this is not an exhaustive list of committees for the House and the Senate, but these are the ones that we work most closely with on pharmacy-related issues. So in the House, there's the Appropriations, Health and Healthcare Disparities, Healthcare Availability Access, Healthcare Licenses, Human Services, Insurance, Labor and Commerce, Prescription Drug Affordability, and Revenue and Finance. And there's enough focus on the price of prescription drugs that we actually have our own committee there. And then in the Senate, there's appropriations, health, human services, insurance, licensed activities, and revenue. And then advocacy goes beyond just the General Assembly. The General Assembly creates the acts like the Pharmacy Practice Act, but the departments are the ones who actually create the rules, which are how the acts are actually put into play. And so we want to ensure that we have good relationships, not only with the General Assembly members, but also with the different departments, since they're actually enacting the rules. So on this, the Department of Financial and Professional Regulation, that's where the Board of Pharmacy is housed. And the Department of Healthcare and Family Services, that's where Medicaid is. The Department of Human Services is in charge of the Prescription Drug Monitoring Program. The Department of Insurance, they're supposed to enforce insurance regulations. The Department of Public Health, I'm sure we're all pretty familiar with that during the past year. And the Department of Central Management Services, or CMS, is not the same as the Centers for Medicaid and Medicare, but that's actually the state's HR department, and they handle the employee and retiree prescription benefits. And then these are some of the pharmacy-related statutes and administrative codes that directly affect us. These are the statutes that govern our practice. Again, this is not an exhaustive list, but these are the ones we monitor most closely for any changing legislation because they will most directly affect pharmacy. And now I will turn it over to Chris.
Thanks, Sarah. So my name's Chris Crank. I'm the Executive Vice President of the Illinois Council of Health System Pharmacists. And Garth Reynolds, who is with IPHA, is right now, I think it was mentioned before, but I know we have some new people. He is tied up giving testimony for a committee related to legislation. So he may be able to join us here hopefully in a little bit. But what that means is Garth able to join? I know his name's there, it's his computer, but I don't think Garth is. So, so you're stuck with me for a little bit at least. Hopefully he can join maybe mid-presentation or when we're having some discussion. One of the things that we've started to do that's been very helpful is ICHP, IPHA, and IRMA. So the Illinois Pharmacists Association, Illinois Council of Health System Pharmacists, and the Illinois Retail Merchants Association have started meeting approximately every 2 weeks just to make sure we touch base on all the legislation. It's great to see where everybody kind of stands, how we all feel about it, and how it affects the different areas of practice, as well as that way we know where we might differ slightly in opinion. So that's always good to know, and we found it's very helpful. You know, most of the time we're usually mostly on the same page in terms of a lot of the legislation. So what I'm gonna do, share my screen here for you. All right, I'm assuming everybody can see my screen. One of the very important changes, Garth and I talked about whether or not we should talk about Rutledge versus Pcma in the, in this legislative discussion. And one of the things, we decided to put it in here because we think it's very important. What it really, in a nutshell, this decision by the Supreme Court allows, or gives states, I should say, some firmer ground to stand upon for regulating PBM practices. Whether that be things like, some states have removed the ability for insurance companies and PBMs to include gag clauses, where the pharmacist can't tell the patient that they could get the drug for cheaper without insurance. Some states have limited cost sharing, PBM disclosures on their price list, rebates. Some states have tried to institute where the PBMs would have to actually say what their rebates are, which is, that's great in terms of transparency, realizing that, hey, your tier 1 drug, the reason why it's tier 1 is because the PBM is getting a big rebate from the manufacturer. So what this decision really does, like I said, in a nutshell, is it really helps reinforce that states are allowed to put in place legislation that regulates PBMs without violating ERISA. And so, right, ERISA is a federal law that really seeks to standardize, to some degree, the way health benefit plans are run. And so one of the main arguments that was used in this Supreme Court case was that the regulation of PBMs by the state was a violation of ERISA. And so, oh, perfect. And Garth is on now. Awesome. So Garth, I don't know, wherever you want to step in on this too, please do. And so what the Supreme Court case really, the verdict that came down was that the state laws regulating PBMs really did not violate ERISA, right? They did not go against that federal legislation. And so the reason why is it affected the Arkansas law said that PBMs had to pay pharmacists at the cost of the drug. And so it really didn't impact what drugs were available. It didn't influence the health plan itself or the benefits provided. And so for those reasons, they said ERISA does not really apply in this case. And so, one of the things that we have is, and there's a lot more information on here, and I can let Garth, comment a little bit as well. But really, in the end, what it said is states do have that ability, without violating ERISA, which is key, to put regulations in place for PBMs. And so what we have is a little sound bite here. And actually, give me 1 second. I need to make sure that I've shared the sound. So I'm going to stop the share for just 1 second here, and then I'm going to reshare, but I'm going to enable sound. And then I'll play this clip, and then Garth, by all means, please jump in and add anything that I missed.
Will do.
The Honorable, the Chief Justice and the Associate Justices of the Supreme Court of the United States. Oyez, oyez, oyez. All persons having business before the Honorable, the Supreme Court of the United States are admonished to give their attention, for the court is now sitting. God save the United States and this honorable court.
We'll hear argument first this morning in case 18-540, Rutledge versus Pharmaceutical Care Management Association.
Thank you, Mr. Chief Justice, and may it please the court. Pharmacy benefit managers are drug middlemen that reimburse pharmacists for the cost of prescription drugs. Those reimbursements are frequently below a pharmacist's cost. That drives pharmacists out of business, and it has left many communities without a pharmacist. Ag 900 responded to that practice by regulating what PBMs pay pharmacists. That response isn't preempted for 3 reasons. It doesn't regulate benefits, it doesn't regulate plan administration, and it doesn't regulate or discriminate against ERISA entities.
Is your approach focusing on who is being regulated or what is being regulated?
It is focused on what is being regulated. As I said at the outset, our test is, does the state law directly regulate a central manner of plan administration? Now, you're right, Mr. Chief Justice, that we devoted a portion of our brief to refuting what we understood to be respondents' only way of distinguishing travelers, which was to say that the law in travelers fell on insurers and not plans themselves, whereas the law here does. And our response to that argument was twofold. First, to say that that's just a misreading of the state law here. It doesn't apply directly to plans. But more importantly, secondly, that even if it did, it wouldn't matter, because at the end of the day, pharmacy reimbursement just isn't a central matter of plan administration.
And the second, as my friend mentioned, is that if the state law produced economic effects as to force the ERISA plan to adopt a certain scheme of coverage, it would indeed be preempted.
Well,
Here,
it's not the state or the pharmacy's fault that the PBMs have such Byzantine procedures that affect drug prices.
Okay. Along similar but different lines, what do we do with the fact that there are plenty of ERISA plans that operate without pharmacy benefit managers? There are plenty of pharmacy benefit managers that provide services to non-ERISA plans. And of course, your clients here are, as I understand it, all pharmacy benefit managers and no ERISA plans. We don't have an ERISA plan that's actually complaining about this before us, as I understand it.
Yes, that's right. I mean, there are amicus briefs filed by sponsors of ERISA plans, but the plaintiff in this case, and therefore the respondent here, is the Pharmacy Benefit Manager Association.
Really, our point is that Act 900 doesn't regulate central plan administration. And to pick up on Mr. Waxman's last answer,
that's all right. It'll start over if we click on it.
All right.
And I'm going to shift over here. Well, actually, Chris, I'll let you keep the slides if you don't mind steering. Just stay on this slide for a second. And so I really wanted to make sure that we played a little bit of the oral arguments for you, because it was 90 minutes. And that's one thing that's very important here, is that we've had 15 years of cases that came down to 90 minutes. And one thing that's really good to listen is it's not about the politics of the bill. It was very much on the legal theory, and that was what was very interesting in the bill. And as we all now know, not only did we get a decision in our favor, it was an 8-0 decision. And that's massive. And one of the things in this article here, that's the implications of Rutledge versus Pcma. It's from Health Affairs blog, and I highly recommend to go read this article all the way through. Is that it really, what Rutledge, the decision in Rutledge helped do, it helped firm up all of our current states' PBM legislation, including Illinois, and stated that because PBMs, that they're not health plans, but they're basically administrative contractors, which is what we've always said, they're claims processors, that they are allowed to be regulated as such, and ERISA doesn't preempt them because they're not integral to health plan management. And that is a massive part of it. And it's very interesting, even still now, when Pcma and the insurance lobby is having discussions with our senators and representatives, they're still trying to muddy the waters with ERISA. And that was was interesting, because in Justice Sotomayor's opinion that she wrote for the court, she kind of gave us a very wide berth in how to be able to address this issue. But in Clarence Thomas's concurrence, it specifically stated that ERISA, this whole thing with ERISA, needs to be relooked at, that it's gotten too big, and we need to move forward with true health regulation on a massive scale. And when it comes to the pharmacy benefit side. And so that was what was really great here. And I do have to do a shout out here. This is Cody Sandusky, IPHA president. Cody and I were fortunate enough to be able to be in DC at the time of the oral hearings. It's not all the time do we ever get a case to the Supreme Court level. And there was not a guarantee that we would win, but we won. And that's the thing to remember, we won. And now we have to take that momentum and move forward. And Pcma is doing everything they can right now in every state, trying to slow the process. And that's one of the reasons why a lot of us are late to this call today, is because we are in the Senate Insurance Committee because PCMA is trying to slow the process. And this is why advocacy is so important. If you don't take anything else away from tonight, understand that being active, getting in front of your legislators is more important now than it ever has been. And we have to build those relationships. We have to get them in our practices. It doesn't matter what type of practice setting you're in. You need to get them in there to show how this is impacting our practice. So I'm going to switch now over to the Pbm bills and kind of talk about the bills that we're going to be focusing on over this next week of advocacy. Oh, you can go ahead and click on the slide. It'll go forward.
Yeah, it stopped.
There you go. So Senate Bill 2008, again, one of the reasons why some of us were a little late to getting on the call tonight. This is our next phase of PBM reform. And I know a lot of people, when we think about PBM reform, we think of it as a community pharmacy issue, and it's not. It's an all pharmacy issue. And because the implications and the damage that PBMs are doing are impacting all of healthcare and impacting all of our patients. And especially as the siloed lines of pharmacy continue to thankfully evaporate and dissolve, because as we start to practice pharmacy in all different ways in our different segments, this becomes even more important. And so when we were looking at how to address and how to implement the court decision, because that's one thing to remember, we're not trying to pass a political bill as such, as we're trying to implement a court decision here. And with Senate Bill 2008, we took the foundations, and we were very fortunate when we were working with Senator Andy Minar and Leader Greg Harris in 2019, that we were fortunate if we put some of the early building blocks from Arkansas Act 900 and were able to get it passed. And that was the bill that caused the court case in Rutledge. So what we're doing, we're building upon that success. And so NASPA, the National Alliance of State Pharmacy Associations, and NCPA worked with one of the law firms that was consulting with NCPA during this whole court process about how to come about model language to address this. And that's what we've done. We've taken that kind of helps solidify our new foundation in patient rights and pharmacy fairness. And we are also looking at the model language for the National Association of Insurance Commissioners. They're working on a model act. It's not finished, but NCPA has really been pushing of trying to help get a great model out there for other states to take a look at, and for the National Insurance Commissioners to be able to help support. We've brought back in our 2018 audit provisions, and we've updated some of them because we had to put them on the side table. They were a negotiated away portion in 2019. We're definitely going to be moving forward with them in 2020. And then finally, what we're really addressing throughout the entire bill is payment fairness. And this is going to be one of the harder things, because it's what we heard today is it's now going to cost $1 billion for us to be able to have, that's going to be an increase in cost to PBMs. And what Pcma stated today, in another way of translating that, we're going to raise your healthcare costs $1 billion because we do not want to give up our profit. And that is a despicable way. We've allowed the PBM middlemen to get too comfortable and too big. And we've got to roll that back. Because if we look at what we're really asking just on the managed Medicaid side, if we're asking for NADAC to be used, so the national average drug acquisition cost plus a professional dispensing fee, there really should be little to no cost to the state of Illinois, because they've already paid that money in the capitation rate for each member to the health plans, which then carve up that money to the PBMs. That money's already been carved up. We're asking for the PBMs to pass along what's rightfully ours, to reinvest that money back into pharmacy access, to reinvest it into communities in need, to make sure we're decreasing pharmacy deserts. That's what we're trying to do with Senate Bill 2008. Again, so we're going to be reformulating some new talking points. So I really appreciate those that have shared the talking points that we have, but we'll be having some newer ones coming out towards the later end of the week. But so we had a Senate Insurance Committee subject matter hearing today. We're going to continue to push to keep this bill moving. And once I have some discussions with our lobbyists and some other stakeholders, we may have some additional direction for you between now and next Wednesday. So we couldn't ask for Illinois Legislative Day. We've picked a great time again. It's really important in the process for our bills, and I'm really glad that we have you all on board this week, because we're going to need your help. So Chris, if you don't mind going to the next slide for me, please. So moving into pharmacy practice advancement. House Bill 135 with addressing on hormonal contraceptive, or expanding access to women's contraceptive rights in Illinois through access to pharmacists. This would expand the definition of pharmacy practice to allow for pharmacists to be able to screen a patient using a CDC established risk criteria and be able to prescribe hormonal contraception in the form of the pill, the patch, or the ring. But we would also, most importantly, be paid and recognized as providers for the coverage of providing a professional service. So it gets us into that provider status, which we've been wanting for so long. And that's a key. Now, granted, this is a hard way to do that. We've been kind of going up Mount Everest backwards with a loaded cart, but this is what we're doing, and we're getting there. We're getting a lot of momentum this year. One of the things that's probably going to change is that last bullet point was that we were looking at a statewide standing order. Public Health's continuing to push back on that because of some internal politics. What we may be doing is just going to a regular standing order model, but we'll still be able to move forward. So it's not the best situation, but it still establishes, it allows for DFPR, the Board of Pharmacy, and Public Health to establish what a statewide standing order should look like. So everyone will be using the same standing order regardless. And so that amendment language should be coming out later on this week. We just signed off on the language this afternoon. And so that's on second reading. And as Sarah talked to you about on second reading, so that means it's out of committee. And so we'll have that amendment reproved by the House Healthcare Licenses Committee, and we'll be able to move this forward. So hopefully this is removing any of the remaining opposition that we have, because Representative Mussman is determined to get this bill across. We've worked on this for 4 years. The remaining opposition that we're having right now is from the Republican side of the aisle, and mainly because this bill doesn't have a time limit. An age limit. And they're wanting to have it so that there is an amendment so that it would limit to only be covered for women who are 17 years and older. And everyone who knows me when I've talked about this bill, it's foolish to think that women under 17 in Illinois of childbearing age are not having sex. That this is 2021. We need to be rational and open about what happens in reality. So, and they deserve to have contraceptive access rights because they have access to other healthcare in women's health arena, and there's no reason why they shouldn't have access to all of the services available to them, and especially through pharmacists. So we're going to continue to work on this. This bill is going to be moving forward, and I'm real excited for this bill. It's getting a lot of great energy this year. So if you don't mind moving to the next slide for me, Chris. House Bill 119. Being brought forward by Representative Guzzardi, and this is on drug repository program. And this bill's been around in some form or fashion for like 20 years, but really only got to a place where really both of our organizations could actually support it in the last the last year and this year, because it's actually trying to set up some real quality standards and making sure that patients would receive safe medication under certain parameters. So basically what this would establish would be if a patient has unused medication that they no longer need, whether it's because of change of medication, death in the family, whatever, they could donate these prescriptions either to a pharmacy, or there would be an established depoting process in the state. And the state would set up a program that would evaluate the medication, make sure it's safe and that there's no damage to it, and be able to help redistribute this back out either through that program or through pharmacies that are willing to participate. A couple things. One, no controlled substances would be allowed. There's a preference on prepackaged medications. that no pharmacy would be forced to participate in this program, whether in the donating it or being able to dispense those, redispensing those medications. The biggest kicker here, we were able to preserve immunity for criminal and civil liability. And that was huge for a couple of reasons. One, we are going to be redispensing medications for those of us that participate in this that has been in someone else's hands. And so we're technically working outside the track and trace parameters at that point. And we want to make sure that we have coverage on ourselves for being able to provide those medications to those that are in need. And also for those doctors and other prescribers who will be writing the prescriptions for these medications as well. So it helps preserve that was the biggest key. That's what stopped this the last couple of times, is because the Trial Lawyers Association has been so adamant about killing it. So this bill got through, is on the consent calendar right now. It just needs to be called. From my understanding, it's going to be called either tomorrow or Friday, and is going to move out of the House this week. It does have a Senate companion, but it's kind of laying low in case we need it. But I'm really glad to see that House Bill 119 is going to be moving through. I'm going to turn it over to, yes.
I just looked, it did, right before this, I looked, well, because you were in your meeting, 119 is scheduled for its third reading.
Oh, good, because I knew it was
just today.
Great. I knew they talked about moving the process this week, so that's great to hear. Thank you. I'll turn it over to you, Chris.
Perfect. So this is a bill that's been around for the last couple of sessions as well. It's Senate Bill 579 by Senator Fine, and it is Facilities Provided Medications is the short title and description of it. And really, what this bill really aims to address is, we all know of patients in health system settings where they're on an inhaler, they're on eye drops, they're getting products that are dispensed to them, and then when they go home, basically because it's not labeled for outpatient use, the medication historically has gone in the trash. Now, some organizations have set up processes to try to address that, like with inhalers, especially given their costs. However, some ophthalmologists, sorry, virtual, kids are getting ready to go to bed. Honey, I can't, hon. Yeah. All right. I know everybody's probably experienced it. I guess I just had my moment with the kids or the dog or the whatever coming into the room, right? They've been really good. They're putting themselves to bed tonight because my wife is working, but there's always got to be something. So with this, like I was saying, some organizations have put together plans to address this, to be able to label things appropriately. Actually, a surgeon was concerned based on the eye drops that were being wasted in their institution, right? They saw that they would put 1 or 2 drops in the patient's eye, and then when they would go home, their moxifloxacin drops were being thrown away, and they had to get a prescription for more. So that's really where this started, was with that same-day surgery type patient that would come in, get their procedure, and then go home. When this was first proposed, this is not going to be one that facilities love, right? Health systems aren't going to love this bill because it does add extra process. It adds extra, right, paperwork, and we're going to have to work out how to make it work. But when this was first proposed, it actually was just any drug that's prescribed that's going to be continued at home that is a multi-dose container needs to be sent home and labeled for the patient. So that's how this bill initially started out, with a lot of discussion with the State Medical Society, as well as IPHA, ICHP, and others to try to talk through this. What we ended up doing is trying to come up with what would be a reasonable compromise, which would be, so again, I'll read a little bit here. It requires that hospitals and facilities offer a patient any unused portion of a facility provided medication upon discharge when it is administered at the hospital or facility, and is going to be required for continued treatment. The things that were added, that's kind of where it stopped before we got involved. With discussion, the medication is going to have to be ordered for home use at least 24 hours in advance of any surgical procedures. The labeling, though, is going to still have to be consistent with outpatient labeling requirements. So your inpatient labels for use will not meet these requirements. The other thing is, right, pharmacies in facilities and hospitals don't necessarily have the resources for every day surgery patient that's going home to provide the counseling and the education. And so one of the other compromises was that the prescriber, so whoever prescribes the drug, is responsible for the counseling of the patient on its proper use and administration. And it does specifically call out, because right, this is an outpatient prescription that's to be labeled that way, that the requirement of the pharmacist counseling in this setting is waived. This is on the third reading as well. So this one has made some progress. It's shown up the last couple of sessions, like I said, and now this time it finally gained a little bit more momentum and seems to be moving. So from a facility standpoint, if you're an institution and you're sending somebody home with a multi-dose container type drug, obviously not injectables, right? These are self-administered multi-dose products, I should say too, that a process is going to have to be implemented where those patients are recognized, there's an order in place, and then we're able to label them appropriately. It's going to be a challenge. The pushback could be, well, this is hard to do, right? But the problem is, you know, healthcare waste right now is a hot topic. Healthcare spending is a hot topic. And basically, you know, patient expenditures related to medications is also a hot topic. So even though this is tough for facilities to do, it really addresses some of those concerns, right? It reduces waste. The patient's not paying for it twice. And, you know, the only argument against it is it's hard to do in terms of process. And so that's why the compromise was what ended up being reached. The next bill is House Bill 711 by Representative Harris, and it's a prior authorization reform bill. And so it would actually create the Prior Authorization Reform Act. And the goal of it is to have some more transparency in the prior authorization process. Really, if I boil it down to what it is better transparency. What are the requirements concerning disclosure of review of the prior authorization requirements? Claims. What is the utilization review of the look like? And the implementation of the prior authorization requirements or restrictions, you know, so more of that information up front. And so, you know, the utilization review organization would not be able to require a prior authorization under certain situations as well. It would put in place requirements concerning how long prior auths are good for. And healthcare services that are automatically deemed authorized if a utilization review organization would fail to comply with those requirements in the Act. And so the other thing it adds is if an insurance company is found to be in violation of this Reform Act, there are monetary penalties for those violations as well. And Garth, I don't know what else, if there's anything else you would want to add to this one, or if that kind of.
No, you've had all the key points of this. This one is still moving forward. I know there's some additional coalition work that's being done, but it is definitely going to be moving forward here soon.
Perfect. So yeah, so like I said, in a nutshell, trying to streamline and make the prior authorization process more transparent. House Bill 1745 on prescription drug benefits is another interesting one that would amend the Managed Care Reform and Patient Rights Act. And what it would do as of January 1st, 2023, it would require health insurance carriers to ensure that by that date, at least 10% of the individual healthcare plans offered in each service area would offer a flat dollar copayment structure for the drug benefit. So in other words, you know, there would be a flat dollar amount for the copayment required for the drug benefit. In addition, at the same time, from a group health plan standpoint, it would require that they have, each group plan would have at least one flat dollar plan or copay system in place as well, or I should say structure in place. And then what it does is by January of 2024, it ramps it up again. And at that point in time, it would be a 25% of individual plans would have to have that flat dollar copay. And the group plans would have to have at least 2 plans that would have that structure of a flat dollar copay. There's some other stipulations in there that the flat dollar copayment structure has to be applied pre-deductible, and it has to be reasonable, and it can't discriminate against or discourage the enrollment of individuals with significant healthcare needs. So in other words, they can't make it so high that people wouldn't choose that flat dollar copay agreement, right? Part of this is to try to make it a little bit, easier for patients to understand what they're going to owe, right? Whenever it's a percentage of a cost or a percentage, right, it's difficult for patients to understand what their yearly out-of-pocket costs are going to be for the medication versus the flat dollar one. If they have that information, they hopefully can get a little bit better idea. The other thing is, the healthcare plans cannot market these flat dollar plans as, oh, well, that's, they're marketed, they can't be marketed differently. They have to be kind of given equal time and equal marketing to their other healthcare plans as well. So again, this one has moved a little bit as well. It's actually it's scheduled for the second reading as well. So Garth, I don't know, I'm always going to ask you too, anything else you want to add to that one?
Nope, not at this point. You've covered it all. It is a massive bill.
Yeah. And as Garth would probably tell you too, a lot of these bills, if you're interested in seeing what all those nitty gritty details are, right? It's ilga.gov, right? /legislation. And you can look these up and see the full text. You can see the amendments. You can see all of the information that Garth and I have talked about related to these, plus some more detail. But anyway, so yes, what we're seeing here is, again, some reform related to the prescription drug benefits as well. So there's a little bit of a theme that you can see for tonight.
And I just wanted to include this slide, and this is something that we're trying new this year, just to kind of help show graphically where, some of our key legislation that we talked about this evening is in the process. So the process that Sarah reviewed with you earlier tonight really can be kind of done as a linear process. So we're still in the beginning stages of these bills, but don't let that fool you. The General Assembly is scheduled to adjourn on May 31st. We will be rapidly moving through the rest of this line in the next 6 weeks. And so we're going to be asking a lot of you in reaching out to your legislators, making phone calls and emails. And so this is just to kind of give you revved up and prepped for the advocacy journey over the next 6 weeks. So I just want to kind of show you this as just an example of where we are in the timeline for these bills to get passed. And I know we're now going to shift gears a little bit, and we're going to talk about how to have a conversation with a legislator and what to do and what not to do. And so we'll be shifting over to Ben Calcaterra to take us over from here. Go ahead, Ben.
Hello. Welcome, everybody. I hope things went well before we jumped on late. As Garth said, we were stuck in committee late, so I'm a little discombobulated, but I think I'm ready to go here. So anyway, what we're going to talk about is what the best way is to talk to your legislator. There is some obvious do's and don'ts that you need to know about before you walk in, whether it's virtual or in person. You need to know what to do and what not to do. So moving along, my name is Ben Calcaterra. I am the Speaker of the House for IPHA, and I've got 3 independent pharmacies down in the far south region of the state. And I have been with IPHA for over a decade now, so I've had a lot of legislative trips under my belt to give you some insight here. The first thing that you want to do when you're preparing for a meet with your legislator, first off, be a constituent. If you aren't a constituent, There are certain times that you're going to want to contact a legislator that is not your legislator in your region. For instance, when one of our bills goes to a committee, we may ask that you call the committee members. You're not their constituent, but you have a purpose to make that phone call for that specific reason. Other than that, if you're just making it an appointment to speak to your legislator, you need to make it within your constituent base. So figure out which legislators are yours. If they're not yours, bring one with you. That's always a nice way. Maybe one of you guys might be a student that is from out of state. Bring a student member that's with you that is in their region. You can go talk to them. That's an example. Know your subject matter. Definitely don't walk in unprepared. They're going to need information. That's what you're there to provide. So walk in being confident, knowing that you've done your homework, you know what you are talking about, and be prepared. Also, always bring written material. That's why we have talking points. Legislators love the one-pager. You'll see later that it actually gets mentioned as a one-pager. That's what they call it. That's why we present it to you. Print it off, take it with you, leave it with them. Summarize points of what we are talking about and the summary of each bill that we are pushing. Anticipate questions. Put yourself in their shoes. If you were sitting behind the desk and you were coming to them asking about one of our bills, what kinds of questions would you have if you had no idea what the subject matter was? Kind of ask yourself, do they understand the terms that I'm using? Do they understand the rationale of what I'm saying? Do they understand how it affects me as a pharmacist? How does it affect my patients? That's the most important thing. They always want to know about how it's affecting their constituents. So most of the time you talk to your legislator, you want to relate it to your patients. It's not necessarily a me thing, but it's a them thing. Keep that in mind. The biggest one out of this list, honestly, dress appropriately. And you'll see what I mean by that in just a minute. But definitely dress like you are there to have a professional meeting with a legislator. Don't come out of the gym and just show up and think it's a very casual experience, because it's not. They will take you seriously if you look like you're serious. Nextly, while you are there during the visit, clear, concise, confident. Wishy-washy, I don't know, maybe, those don't get you anywhere. Be confident with what you know. You've done your homework. We just approached that in the slide beforehand. You know your homework, you've done it, you know what the subject matter is. Present it clearly. Think before you speak. One thing that we don't want to do, and the next one down there says never exaggerate and always be honest. That kind of goes with the think before you speak. Don't just spurt something out that you haven't thought out, because the last thing you want to do is say something that doesn't make sense, is not coherent with what you're presenting, and especially is not truthful. So make sure that you think about what you're going to speak about before you open your mouth. Next, give your main points early. A lot of legislators like you to kind of do a conclusion in the beginning. Summarize it first. Give them the bullet points and then go into your detail. Expand on them later, but give them the points up front so they know what they're about to listen to. While you're giving them the details, they've already had the bullet points and they can kind of focus in on those details a little bit better. I already said before, make your subject matter personal to your experience. Tell them your story. Tell them your story. Tell them your patient's story. Tell them things that matter to you and your patients and your environment. You might go in trying to get a bill passed for all pharmacists in the state of Illinois, but you are in that room with your legislator because you are their constituent and they want to take care of their constituents. So make sure that they understand that you are speaking from the heart and from experience. Assume your legislator is not an expert. This is a big one. We in the pharmacy world have acronyms of things, PBMs, MAC lists. They don't necessarily know what those things mean. You might need to kind of dumb it down a bit. You're speaking to a lay person. They're not an expert in pharmacy. So remember that you are not talking to a peer at this point. You're speaking to someone who is not well-versed in the areas that you're speaking about. It's okay to say, I don't know. Again, before, don't exaggerate, don't lie, always be truthful. If you don't have that answer, tell them that you'll get back to them. That is a fair answer, and they would appreciate you following up anyway. So if they ask you something that you're not sure about, say, hey, I don't know that right offhand, but I will get you that answer. I'll do my homework. I'll ask someone who knows. I will bring it back to you. When they do ask you a question that you don't know, write it down. If you write it down, you'll remember to come back to it later. Don't rely on your memory. There's a lot going on, and especially if this is your first trip, you may be a bit nervous. You walk out of the room, amnesia. You forgot what they said. So you don't know what question you need to come back with. So write everything down. Last steps before you leave, make your ask. You are there for a reason. You are there to ask them for a yes vote or a co-sponsorship on a bill. You are there to ask something of them. So don't forget to ask. Don't just say something like, hey, we've got a bill. You need to research it and leave. You need to tell them what they need to do with it. And usually it's going to be either a yes vote or a co-sponsorship. Also, leave a business card. My personal preference, take 2 with you. Leave one with the secretary. Sometimes they keep it in a file. Sometimes they give it to your legislator that you're about to speak with. If they keep it in a file, you need to have a second one to hand to your legislator because they like to see who they're speaking with too, especially if they've never met you before. They will keep that business card on their desk and look down to remember what your name is before they speak to you. That's a trick that they use. Leave any written reference materials. Remember I said bring the one-pager? Don't forget to leave it with them. Don't walk out the door with it. It doesn't do any good then. And then most important, thank them for their time. You're about to hear the video. I might say thank you 100 times because it is very important to thank them. They are very busy. They have a lot of appointments to catch. They want to speak to their constituents, but it's hard to work you in sometimes. So make sure that you thank them for taking time out of their busy schedule. And then after the visit's done, remember that follow-up. If you have any questions, get it back to them. Don't forget to not respond to follow-ups. Write a thank you and remind them about the big ask. Remind them that you asked them for a yes vote or a co-sponsorship in written form in your thank you letter. It is a big deal. They appreciate that, and it will remind them a couple days to a week later that you were there, and then that's almost a second encounter, a second touch point. So with that, let's watch a video. Give me just a minute. I need to start a new share here. And I hope this works correctly. Okay.
Dave, there's a Ben Calter here to see.
Okay, great. Thank you. I appreciate it. Hey, Ben.
Representative Sever.
Good to see you.
Thank you for taking time out of your day to see me.
Absolutely. Absolutely. Appreciate you coming by. And once you come into my office, I'll be glad to talk with you.
Okay, thank you.
Need something to drink or anything?
I'm good.
Okay. All right. Come right in, have a seat. So I know that we talked a little bit on the phone as far as some things you wanted to talk about, but go right ahead, take all the time we need.
Well, first of all, I really want to appreciate the time that you've taken out of your day to meet with me. I know
Sure.
you've got a busy schedule, so I won't keep you long, but we do have some very important pieces that we are trying to move. One is our very important pharmacy fairness bill that's going to bring patient access, grant patients the right to have their prescriptions at the cost that they deserve,
Right.
keep small business pharmacies open. We're going to put some regulations on businesses that are wildly unregulated currently and allowed to make business practice very tough on the small business and on our patients and on your constituents. And I'd just like to impress upon you the fact that it's going to be great for everybody and all of your constituents across the state.
Well, I appreciate that, and that, that's one of the things going on, and that's very important in the state as far as that people not only in Southern Illinois but statewide can get the medications that they need in a timely fashion, and also something that they can afford. So I appreciate you coming and talking to me and bringing this important initiative to me. I appreciate that.
Thank you. So the biggest parts of this bill are going to be able to keep patient costs down, like I said. So we're going to make sure that monies that are coming into the large corporations are passed on to patients. That's going to help patients be able to afford their medicines so that they can stay on the life-saving medicines that they need to be.
Sure.
The next piece is going to be on the small business, like I said earlier. And that's going to allow small business pharmacies across the state to be able to contract a little bit better, get more fair reimbursements for the products and services that they're giving out. It's going to be able to keep doors open. As you're very well aware that pharmacies are closing at an increased rate because of these middlemen that are crunching down on business practices. And we're just trying to make that fair so we can keep our doors open. When we keep our doors open, we eliminate pharmacy deserts. We give patients access to those drugs because they're living close to pharmacies. And if we take those pharmacies away from them, sometimes they have to drive 30 miles to go to the nearest pharmacy. So we're trying to keep those doors open. Another piece that I haven't mentioned yet is some audit protection. This bill is going to give our pharmacies some protection against the wild audit practices that we have not had any protection against in our state yet. So we're trying to make that fair. So pharmacies who are trying to deal with the pandemic and taking care of their customers and providing all these extra services that have come upon us, we don't have to take time out of our day to respond to onerous audits. There's a place for audits. We just want them to be fair.
Sure.
And those are the major points of the bill. So again, I would really ask for your co-sponsorship on that bill so that we can have your support.
Sure. You know what, when I was first elected, one of the first things they taught me was then when someone comes and talks to you about a bill, that you have them share, of course, the proponents and who's for something, but then also to ask, so who would be against this, and tell me why I should or why I shouldn't be for this.
Sure. So the only opponents that we know of are the people who are profiting from not having this bill in place. That would be from the pharmacy benefit managers, the PBMs, those are the middlemen we've been talking about, and some of the insurance plans that are actually vertically integrated with those businesses. They are profiting by not having a bill in place to protect our patients and our small business.
Sure.
The proponents, every patient across the state.
Right.
Every patient will benefit from this. All your constituents will have better price protection. They'll be able to go to the pharmacy of their choice, not be steered towards mail order, not be steered towards the pharmacy that's owned by the insurance plan that they have their benefits through. So these are protections for our patients. Obviously, small business pharmacy is a very strong proponent of this. We've also got proponents in several of the professional associations, and we've got national support behind this bill as well.
Sounds like you've done your homework, and that's really important, because a lot of times when people come in and talk to me in my office, they maybe haven't done all the background work to find out just what, they'll have a great idea for a bill, but then what are all the proponents of it, and what are all the pieces of it. So I appreciate you sharing all those different things. And, something that's really important to me, I get phone calls on a regular basis as far as people are saying, hey, what can we do about, we're trying to get medication for my son or my grandson, or there's a challenge or whatever. In fact, we've even been in contact, and you've shared some of the stories with me as far as some of the things with the PBMs, that the holdup. And the other thing too is that flow through of payments from them. And so I'm very aware of those concerns. So I appreciate you bringing that forward to me today, and I will look at that very seriously and look forward to working with you on that bill.
Well, I really appreciate you taking the time again out of your day to listen to my ask on the bill to be a co-sponsor.
Sure.
And I'd like to leave you with these documents.
Okay.
These are talking points, and I'm not sure if your secretary gave
I appreciate that. Thank you.
I'd like to give you another one.
Sure.
And again, I do appreciate all the time that you've taken. I know you've got a lot on your plate, and anything that I can be of service to you to answer questions,
sure,
I'm always available.
Well, I appreciate that very much, and I appreciate you doing your homework, bringing me the what we call the one-pager as far as to give me a synopsis of the bill. And so I see we've got a House bill and a Senate bill both, and looks like that we're working the Senate bill. Is that correct?
That is correct. Currently, we are pushing the Senate bill,
okay,
so that we will be looking to move that in the coming weeks.
Okay. Well, I'll keep an eye on that. I'll be talking with some of my other legislators, and we'll discuss this too. A very important issue. Look forward to working with you on it and bringing this home.
Perfect.
All right.
I appreciate it.
Hey, thanks for coming by. I appreciate it very much, and have a good day. Thanks.
You too. Thank you very much.
Thank you. Have a great day.
Yeah.
Ben Calcaterra.
Who?
Ben Calcaterra.
Yeah.
I speak to you.
I don't know who that is. Has he called and made an appointment or anything?
No, he just showed up and he wants to talk to you about some bills. And he did not.
He owes money, or he's of a House bill, or did he even say?
Did not act like he wanted to say.
Okay. Well, I'll talk to him.
Okay.
I'll be glad to talk with him.
Okay. Ben, this is Dave Severn. This is Ben Calcaterra.
Hey, Brett, what's up, man?
Hey, how you doing?
I'm okay. I'm okay. What's your name again?
Severin.
Severin.
Representative Severin.
Thanks.
Yeah. Yours
nice
again?
My name's Ben.
Okay.
Yeah.
Yeah. So you wanted to talk about some bills. You having trouble paying your bills, or?
No, there's this bill, man. I got this drug business going on, and I need this bill passed so that we can get paid right. I mean, I really need this. It's gonna be great to keep my doors open.
So where are you from, Ben?
I'm from right here in Heron.
Yeah. Okay. So how long you been in business?
I've been in business for 3 years.
That's awesome.
Yeah.
So
Now,
what kind of business is it?
It's a pharmacy, man. I sell drugs.
Right.
Everybody needs their drugs.
Yeah.
And I really need this bill passed, man.
Okay. Yeah. Well, I'll tell you what. Why don't you come in and let's talk about it? Okay.
Okay.
All right. You can have a seat right there if you would. Is it Ben? Is that right?
Ben.
Yeah. Have a seat, Ben. Yeah, so normally when someone calls and is concerned about a bill, whatever, why they'll call ahead and make an appointment and share with me what's going on. That's fine. We can talk, but
I just thought that you had time for all your people. So.
Well, I'm more than happy to talk with you.
Okay.
And just a lot of times people will call ahead, so I kind of can do some homework and find out what the bill's about, whatever. So tell me about what these concerns are.
Well, I mean, I'm just not getting paid right. I mean, I am really having trouble. Every time I sell a drug to my people, they come in the door, they need their medicines, I fill their drugs, and I'm just not getting paid. Right. I can't pay my bills because they're not paying me, and I think it's wrong. And this bill is supposed to fix everything. They told me it would fix everything, and I really need this done.
All right. You don't know, you have to know what the bill is, or the name of it, or the number?
It's a PBM bill. These PBMs, man, they're bad. They're bad folk, and we just need to get rid of them. I've been told that this bill is going to be the thing that gets rid of them for good, and we're going to be all good from here on out.
Well, I'll tell you what I'll do is I'll look into this, and I'll find out what the bill number is, okay? And I'll check this out and see what I can find out, and then I'll get back with you. But I need a little bit more information. You know what I'm saying? As far as we want to make sure that you get paid. We want to make sure that your customers get the items and the services they need. But I just need a little more information. So I'll do my homework, and I'll find out what that bill number is, and I'll check on that. And then what I might even do is talk to the Illinois Pharmacists Association and get some information from them, see what we can find out there. And do you ever talk to them or work through them at all or anything?
I get their emails. I don't really read them much. I'm sure they've got some info in there, so you can talk to that IPHA folk. They'll tell you what to do. Okay. I'll tell you what, once you figure it out, I really need that bill passed.
Well, hey, I tell you what, you hold on to that, and because I'm going to work for you no matter who you are, what your politics are, but I don't need that.
I thought this was the way it works. I grease the wheel.
No, that might be somewhere else, but not here. Here's how we do it. So that I work for Republicans, Democrats, those people that are not even affiliated with parties, work with just whoever has needs in the community, work with them, and that is not how it works. You know, in the old days, people talk about politics, you know, greasing the wheel, whatever. I'll tell you, that isn't how it works.
Well, I'll tell you what,
okay,
buddy, if you can't get this bill passed for me, we're going to have some problems. I know where your office is. I know where you live. We're going to get this done, and I tell you, I need that vote today.
I understand. Here's what I'm going to do. I will make a phone call. We'll find out what that bill number is. We'll find out what the status of it is. But I can guarantee you one thing, that I will check into it. Can't guarantee that we can fix it. Can't guarantee that it'll happen today. But I'll look into it. I'll get back with you. And so we need to get your phone number. Do you have an email address?
Yeah, it's pharmacy@drugs.com.
Okay, all right. Well, let me write that down. Say that again, please.
Pharmacy@drugs.com.
Okay.
And I'll tell you what. You get this done for me, I'll make you a deal. You get me this bill passed, I'll give you your drugs for free. No co-pays. No co-pays at all.
That isn't how it works, sir. I'll tell you here's how it works. We work for everybody. Business people, people that aren't in business, retired kids, we work for everybody the same, and there's nobody giving money under the table. There's no freebies. I pay my bills just like anyone else. But and the other thing is, you really shouldn't be coming to your legislator and trying to offer money or trying to offer these deals. That isn't how it's done, sir. Here's how we do it. We're very professional. We work collectively as far as legislators. We work across the aisle. So if it's a bill that we need Republicans and Democrats both to work on to get it passed, and so that's how we do it. Then we send it over to the Senate, and the Senate works on that. If the bill gets passed there, it goes to the governor. We don't, those kinds of things, that's what gives legislators bad names. That's what gives business owners bad names, trying to offer money or free medication, drugs. I'd suggest that you change your views and your thoughts. That is not how you do it.
Well,
in fact, it really would have been good if you'd called ahead of time, made an appointment, kind of share with us what's going on. Again, more than happy to talk with you. I'm more than happy to look into this, but I guarantee you that there won't be any, it'll be a handshake that we're working together, and that's as far as that'll go.
I guess I'll take what I can get, brother.
All right. Well, hey, thanks for coming in. And what was the name again?
Ben.
All right, Ben. All right. Well, thanks for coming in. Lori will let you out, and I'll keep in touch with you. She'll get your phone number, and I got that email address. What was it again?
Pharmacy@drugs.com.
Okay.
Can't forget.
I got you. All right. Well, thanks for coming by.
Rock on, brother.
All right.
Well, I hope you all liked that one. A lot of work went into that, but hopefully you learned something, both what to do and what not to do from that video. So what we're going to do now is ask, what did you guys catch? What did you see? Are there things that you noticed in either side of the video that caught your eye, that maybe we didn't mention or talk about, or that you had no idea about and that you just learned for the first time? Either put them in the chat. I don't know. Can we raise hands and speak at this?
Yeah, we can raise hands in this.
Okay. Anybody have any comments? We can also go ahead and go to questions in the same spot. So anybody have anything to say? Questions, comments? No? Okay. Well, I hope you guys learned something. You've now learned how to speak to a legislator. And here we go. We've got a question. In the virtual world, do we offer to email our one-pagers? I would say the answer is absolutely yes. Get it to them however they are willing to accept it. More than likely, you're probably going to not email the legislator directly. It's probably going to go to a staffer or a secretary, but they will get it to them. They will alert them that you've done that. So if you have the chance to speak directly to the legislator, the one-pager may not go directly to him in that event, but either way, yes, offer to send it. They will tell you how to get that to them. Definitely make that offer. Great question. Is the best way to set up the initial appointment to call or email? I would definitely say call. Staffers are very well attuned to receiving those phone calls and making appointments. That's what their job is. I would not reach out by email the first time. A phone call is always more personable. It will get an effect from them better than an email will. So my suggestion is definitely make a phone call to the published number that you can find on the ILGA website, or do we have that on Voter Voice? We do, right? Their phone numbers?
Yes, we do. And that was one thing I was going to talk about after you're done here.
Cool, perfect. What about the link included in the Ledge Day registration?
Yes,
yeah,
that will also work as well with setting up the appointment.
Yep, that will definitely work. Great questions.
Hey, Ben.
Yes.
What else is different virtually? So, you kind of gave a good example of in person. What are some of the Zoom tips, or, what have you seen gone wrong in terms of some of the meetings when it's via computer? Other than a kid coming in the back door, asking a question about bedtime.
Yeah, definitely put your kids to bed either before or well after the virtual meeting is the suggestion there. No, the things that I would suggest is still dress appropriately. Don't forget that you are meeting with a legislator. We sometimes get comfortable in Zoom meetings and we show up in a level less than the time before in the dress code and attire. So don't come in your sweats and your t-shirt, forgetting that you're meeting with a legislator. Definitely still dress appropriately. All those things we talked about still apply. The other thing is what we learned just a few moments ago in the Senate hearing. Use your mute button appropriately. Don't forget that it's off and say something off color. That will definitely be a huge negative. That's something that is kind of new to the Zoom world is, you don't have to worry about that mute button in real life, but we do for the Zoom. The other thing, if you're going to meet with a legislator, I probably wouldn't use a background like the virtual background I have here. You are meeting as a constituent. You are meeting as a person who is in the region of your legislator. Go to them as that person. Don't go to them as some fictional person sitting on a beach. Don't have a company letterhead up there because you're not going representing a school or IPHA or ICHP or something like that. You are going as yourself. Remember that. You are a constituent talking to your legislator. So that would be another thing. Boy, that's a good question. That's all I can come up with on the spot with differences for Zoom. Anything you guys can think of?
The only other thing I would talk about, you kind of mentioned virtual backgrounds, but just make sure that your actual background is appropriate as well.
Yes.
Don't do your Zoom meeting in the bathroom. Or make sure that whatever you have on wall hangings is considered to be business appropriate. So do take a look at those concerns as well. You want to present yourself in as professional a manner as possible.
Definitely.
The other thing, and all joking aside, in terms of, stuff's going to happen with technology too. Don't let that overwhelm you either, because just on the committee this morning, one of the individuals sounded like Alvin from Alvin and the Chipmunks because the sound, the way it was coming through, they had a high-pitched squeaky voice for whatever reason, right? So, I mean, the legislators are used to that, right? Nobody was like shocked or in horror that, there were technical difficulties. Everybody's used to it now. So, you'll be able to dial in or figure some way to make it work with them.
Yeah, especially when you're an attorney in a cat face, right?
Well, the representative actually said you sound like Alvin from Alvin and the Chipmunks. So
that's great.
Yeah.
Let's see here. Wear nice clothes, quiet professional area. Yes, they can read lips as well. Yes, that's a very good point. Just because you're muted, they can still see your actions. Talking point sheets and finding your legislator are in the advocacy center. Give time for them to respond and try not to walk over their response. That's a very good point. it is very much considered rude to step on people, whether it's in person or Zoom. So remember that Zoom doesn't change anything. The difference in the Zoom meeting is it's harder to judge when someone is talking and when it's your turn to talk. So make sure you give yourself an appropriate pause after they've finished. Make sure that you recognize if they are asking a question or making a statement and requesting you to speak afterwards. They may be rolling right into the next paragraph of their soliloquy. So yeah, that's another good point, is to make sure that they are ready for you to speak. 5, 4, 3, 2, 1. Yes, exactly. Anybody else? Questions, comments before we move on? I think we spent enough time here. I hope you guys had a good laugh. It was fun to make. Dave Severin, my representative, was all for making that video. He would like it to actually be used in other arenas because he thought it was a great idea and a great learning tool. So hope that works out. Thank you very much, and we'll pass on to whomever's next. Garth?
Yes, thank you, Ben. And I want to go over just, I know we've talked about the Advocacy Center just a little bit. And I know we all have different tools to be able to find our legislators and everything. But, you know, we are running at least Legislative Day this year through the IPHA Advocacy Center. And it's found on our main homepage right now. And it's a new addition to the website. So you'll see on here different campaigns like we've talked about for those that can submit witness slips for various bills. You all registered for Legislative Day using Voter Voice. So I really appreciate you guys using the newer interactive platform. This helps with being able to put your information in here, and so that it'll help identify who your legislators are. Also, don't forget, if you haven't registered for the legislative panel for next Wednesday morning, please do that. That's a separate Zoom link. It won't be the information you received tonight. The good things about the Advocacy Center is you're able to find additional information on legislation. Like what Chris was talking about with going to ILGA, you could do the same thing through here. Like if we knew that we wanted to find out the status on House Bill 119, for instance, you can click into it and it automatically brings it up, says, oh, it's prescription drug repository. And that'll actually take you directly to the ILGA part of that website. So if you click on that and you'll see it brings it up here, and you click here and it goes to the bill text. So it's a nice way of being able to interact. It also tells you who the different sponsors are, and you can go right to their contact information on any of the bill sponsors directly from here. Other things as well is, I know not everybody knows their legislators, and that's something that between now and next Wednesday, we all have a little bit of homework to do. You go here and you put in your information, and if you type in your address, and so I put in my old home address for my parents' old pharmacy, and it states, here's all the people I can contact. I can go all the way to the president. We can contact our federal senators and our Congress people, and then also our state. So our our constitutional officers, and then our senator and representative. And so let's say I wanted to send a message to Senator Fowler to be able to say thank you for being a sponsor. And it's already conflicting knowing that I'm in here a couple times, so it's telling me I'm doing this a different way. And I can type this message to him and be able to send off this, or if I was asking to be able to meet with him for an appointment, I could do that as well. So there's just various ways that if you wanted to be able to look up information, if you wanted to call, like it's already determined my other profile. So it's brought me back into Springfield with Senator Doris Turner. And you would just call her information here and you could be able to set up the appointment directly. So the voter voice is designed to kind of help make this a lot easier process for everyone. So please give us feedback on it as we go forward. We want to make sure that it's working best for you to be able to make Legislative Day a success for you as well. So as we talked about earlier, talking point sheets are going to be updated, and those will be available, and we'll send a notice out. Hopefully we can get them re-updated tomorrow. If not, it may be first part of Friday. But we do want you to be asking and interacting with them. This is really a week of advocacy, especially those of you who have the ability right now, depending on your protocols, of being able to have people on site. You know, I encourage you to invite your legislator. They should be back home over the weekend. So invite them to come to your practice site if you can. So you can talk to them about these bills. If not, we will be joining everyone together, and we'll have reminders of advocacy and outreaches over the first part of the week. But we'll be joining back together next Wednesday morning at 9 o'clock. We'll be having a short panel. We've invited some guests. We hope to be able to announce those as we have them confirmed. And I really appreciate everyone's understanding and patience in advance as we are doing this entirely virtual. Even though we've been doing virtual for over a year now for a lot of our meetings, doing an advocacy event is a lot more difficult than you may think. And we really appreciate everyone's patience as we try to make sure that you have the ability to have your voice heard. Because you are the experts in your constituents as a constituent in your legislators district, and they need you to be there as a resource. I mean, IPHA and ICHP are there on the state level, and we're educating all the time, but they really need to hear it from you as well. And so I'll leave you with that, and I'll leave it for Chris for any last statements as well.
Just wanted to say thank you to everybody. And I think, you know, to echo a little bit of what Garth said in terms of that three-pronged approach is really the key to being successful, which is, right, it's the individual, number one. So grassroots types effort where the constituents actually go in and talk to their representative or their senator, with the organization like ICHP or IPHA supporting that as well. And then with the work of the lobbyists from each of the organizations in conjunction with that. And if you can get all three of those, you know, arms working for you, then you really can accomplish a lot of things. So, you know, I really appreciate everybody being interested in advocacy and promoting the profession of pharmacy and what's best for our patients and for our pharmacists and our techs. It's really the key. So thank you.
Any last minute questions? Anyone? You can raise your hand or put it in the chat. All right. Well, that will wrap us up for this evening. Thank you again for taking your time out in a busy week. And we look forward to the engagement over the next couple of days. So thank you. Have a great night.
Have a good evening. Thank you.